Hello, I want to welcome you. It's March 23rd. This is our second briefing on the COVID-19 virus that we're dealing with in the city of Murfreesboro, that we're dealing with over the state, and that we're dealing with nationally. So I want to give you a few updates. I've got a couple of guests that I'm going to introduce here in a few minutes to get some information out to you. We declared a city an emergency this past Saturday. Want to explain to you again what that means. What does that do? It allows the city to be able to suspend several purchasing guidelines. It allows us to be able to make decisions based on public safety, health, and welfare. In that order, we did make the decision that we closed indoor dining in our restaurants pursuant to CDC guidelines. That doesn't mean that takeout, that doesn't mean that pickup, curbside delivery. I really want to encourage you to be able to get out and patron your small businesses to help them through this time, to make sure that you're still being able to support, but being able to practice social distancing and follow CDC guidelines. We did put a halt on gyms and exercise facilities and also gatherings that are over 10. One of the things that we really want to stress, we can put guidelines in place, we can ask for certain things to come across to be able to from the governmental side, but we have to practice personal responsibility. That, I had someone who called me today about a barber shop or a beauty salon that had 30 people in the beauty salon. This order does mandate that any gatherings over 10 are things that we don't want to be able to do. So we need your help. We need to be able, as a community, to work together on these. So I want to give you some other information. I had a lot of questions about finances inside the city. Your city council's worked really hard on the financial standpoint of this city. We have a very healthy rainy day fund. Several years ago, made the decision to completely get out of variable rate debt. So the variable rate debt right now, our last number was almost 9.5%. So the majority of all the funds that we have inside the city are all fixed rate. So we're looking in really good shape there. We are getting ready to go through our budgeting process, and we have made the conservative decision to make sure that we're looking at how this affects us in sales tax, how this affects several different items. So we're working on all of that. The Parks and Rec department continues to be closed. Outdoor facilities are still open. The greenway's open. Other areas outside that you still can go walk. Dr. Patel was here the other night and really encouraged to make sure that people do social distance, but you still need to be able to get out. You need to exercise to get fresh air, so work on some of those things. Our police department, our fire department, our emergency service providers are all in line to make sure that essential services are still going forward in the city of Murfreesboro. We've got plans and we've got procedures in place to protect our emergency service providers. We've got plans in place that if an emergency service provider becomes test positive, to be able to make sure that we protect them and their families. So want to really ensure our staff and also ensure the citizens that we do have those plans in place. Solid waste is continuing to pick up trash. That's something that we are absolutely going to continue to do. I would ask your support and your help that it's essential that we pick trash up. It's not essential right now that we're picking up grass clippings. Please work with us not to put your grass clippings on the side of the road right now. We really want to be able to make sure that we're picking up trash and not picking up grass clippings right now. So please work with us on that. Want to reiterate that Murfreesboro Electric Department, Murfreesboro Water and Sewer Department, Consolidated Utility District, and Middle Tennessee Electric have all got policies in place to make sure that no one's electricity or water is cut off right now. Obviously, if you can, you need to pay your bills, but we're going to make sure that all of our residents are protected. Comcast, AT&T, several of your service providers are making their hotspots throughout the city available. So you want to research that to make sure that you do have internet access to be able to keep up with what's going on inside the city. Talk to Dr. Gilbert with our Murfreesboro City Schools. Our Chow bus is running. There's 38 different sites throughout the city that kids can get food. So really 18 and under, you don't have to be in the Murfreesboro City School System. You don't have to be a city resident. You can come and any child can get food. We're making sure that service is provided. We're making sure it's up and running. Our SROs are accompanying the child bus to make sure that everything is coming across and still being provided. We are going to push some information out tomorrow. We're going to need your help on some donations to make sure that we can continue to run that child bus. So you'll see that being pushed out here before too long. One thing she wanted me to make sure and let everyone know, they are giving backpacks out on Fridays for kids who may not have food over the weekend, so that's something that service will continue as well. Local leaders are continuing to work together. I have talked to the mayor of Smyrna today, talked to Mayor Ketchern here in Rutherford County today. We all are working together to make sure that all the citizens in Rutherford County are protected. We're being unified on the decisions that we're having to make. Continually talking with our city council, who is doing a phenomenal job making sure sending things that we need to know about. They all have different spheres of influence to make sure that all of those questions are being asked and concerns are being answered. We are working with the state, and I think it's important to note just as how we're set up from a health standpoint inside the city of Murfreesboro. There's a lot of comparison where you're looking at Metro Nashville and how Metro Nashville is set up, and we're completely different in Rutherford County, and really the way Metro Nashville is set up is the minority on how the majority of Tennessee counties are set up. There are actually 6 Metro health departments in the state. You have Shelby Metro, Madison Metro, Davidson, Hamilton, Knox, and Sullivan County. There are 89 other counties that are set up the way that we are, and we have a local health department that is under direct supervision of the State Department of Health through its regional offices. So the Tennessee Department of Health directly oversees 89 county health departments and serves as partner organizations to the 6 major metropolitan jurisdictions. So our city stands to support and assist our local, our state, and our federal government, but the guidelines that are being sent to our city are being sent from the state to the county health department and then disseminated to us. So I think it's important to understand the difference between Metro Davidson County and also Rutherford County. Now, that doesn't go to say that we're not working with Metro Nashville, because we have a lot of people who are either commuting to Nashville or have commuted to Nashville, and as a mid-state area, we are all working together to make sure that we have containment. Did have a call with Dana Garrett, our director of the Rutherford County Health Department. There are 9 confirmed cases inside Rutherford County. With those 9 confirmed cases, we don't necessarily know where they are in Rutherford County. I think it's important. She wanted me to reiterate there are patient privacy laws. So if someone is tested, and they're tested positive, the health department then follows up with that individual. They follow up on their contact, where they've been, if they've been in any meetings, if they've been at church, all those different things. So they then trace back and track to the individuals that they've had contact with, and from there contact those individuals to make sure that anyone that could be at risk is identified. So I think that's important to understand how that process goes. Got a couple of guests tonight. I thought it was important to make sure that, in our community, St. Thomas has been a fixture here for many, many years. And our healthcare, one of the things when people move to Murfreesboro, our healthcare system that we have here, I would argue, is second to none. So I asked Gordon Ferguson, who's president and CEO of Ascension St Thomas, and also Dr. Julian Yang, who's the chief medical officer of Ascension. I thought it was important to have them come and get some information out to let you know as a community what they're doing, and to hear from the medical leaders in the community of what as citizens we need to do and what we need to be aware of. So Gordon's been a friend for a long time, and Gordon, I appreciate you being here, and I have had several different meetings with Gordon, and his leadership and the way that we see our medical community responding is phenomenal. So Gordon, wanted to give you the mic to really update us on what we need to know and things that Ascension St. Thomas is handling.
Thanks, Mayor, and I want to just start off by expressing my appreciation to you and our city leaders, as well as Mayor Ketron, I think one of the great things that we've got going for us here in Murfreesboro and Rutherford County is the ability to work together. And whether we're dealing with a tornado or something like what we're dealing with today, it's very reassuring to me to know that we can call on one another and collaborate in terms of how we are responding to different issues going on in our community. Certainly, something like this is an issue that is not at all common for us to deal with. We have other events that we prepare for as part of our disaster preparedness at the hospital, but I have to admit this is one of the most complicated type situations that I've dealt with in my career of 30 years. Saying that, there are some very common sense type things that I know we've all heard about. First and foremost, the importance of washing our hands. You'd think that's something, well, we all know about that, but practicing the right way is something that I know a lot of attention has been placed on, as well as the social distancing. And I do hope, as you said earlier, Shane, that our community takes that seriously, because these things really make a difference in how we're going to respond to the COVID-19. In terms of working with the community, we did have a meeting at the hospital last Friday. It involved leadership of the health department, Stonecrest, Trust Point, our local EMS, as well as the fire chief. And you were there along with Mayor Ketron. I think we had a very good dialogue walking through what each of the organizations are doing in response to this. I think we're probably 3 weeks into this, and it's amazing to me how a lot of different resources have been pulled together in terms of how we are responding to this. I'll admit we don't have all the answers. We're making decisions both as a local hospital, but a lot of our response to this particular incident, we are relying heavily on our system, St. Thomas Health in Nashville, as well as Ascension, which we have communication daily at the national level, and then also locally we've got management huddles that we have twice a day. We're no longer doing them in person, we're doing them virtually, even within the hospital, making sure though that everybody is up to speed on the latest guidances that we're receiving from Ascension, and that we're making sure our department directors have what they need to implement our different action plans. I think most visibly, the public should be aware at this point that we have restricted our visitation hours. We're doing that in parallel with other hospitals in the area. If you don't need to be at the hospital right now, please don't come. And we feel that that is being received well. We've got associates placed at our major entrances, making sure that they're doing a screening. And if you've gone through that screening, you get a dot to show that you're good to come in. But really, our visitation is very much limited, with the exception of our OB patients and those patients that are nearing the end of life. So we do want to be respectful for these two population groups. The other big change that we did put into place last week with the support and buy-in of our medical staff was curtailing any non-urgent elective procedure. We did that for a couple of reasons. One was just to really make sure that we are managing our capacity right now so that patients that need to be in the hospital can be there, and those that can put something off for a few months with no adverse outcome can do that. We also did it as part of our overall conservation of protective equipment, personal protective equipment. We are not out of key items there, but we know that with what may be coming down the pike, that we've got to really be judicial in how we are distributing our gloves, our other protective gear. Ironically, an executive order did come from Governor Lee today, really mandating hospitals and outpatient surgery centers across the state take that action. So a lot of things are being done. I want to just say how grateful I am to our physicians, and Dr. Yang can comment more about this, but also to our associates. Members of our senior leadership team were present in the hospital throughout the weekend, and just expressing our appreciation to those nurses that are really in the front line of this, whether that's in the emergency room or in our critical care areas. They are there, they're doing their job, they know what needs to be done, and we want to be there to make sure they've got what they need and they've got the information that they need. I will say our hospital volume is down significantly right now, and that is a good thing. Our emergency room visits have taken a big drop since this was first announced, and I think that, again, is good, so that just those patients that really need to be there have that access to our facilities and our resources.
Great. Dr. Yang, I was talking to Dr. Yang earlier. He got here in September of last year, so I want to say welcome to Murfreesboro, but give us your thoughts and your input what we would need to let our citizens know.
Sure. Thank you, Mayor McFarland. I think our message here tonight from the physician community to the citizens of Murfreesboro is a simple one, and it's really that although the symptoms of COVID-19 are very similar to the flu, this is not the flu. It's a fever, it's a cough. However, this is a very different virus. The coronavirus, actually, as it were, is one of many viruses that causes the common cold. However, this particular mutation that occurred in Wuhan City coming from China is something totally brand new, something we have not seen, and because of that, it's particularly dangerous. And so the science out there still is evolving, and we're taking our best direction from all the medical leaders throughout the country. But we do know that this virus is easily transmissible, and that for many people that the symptoms may just be like the flu, and that somebody who contracts COVID-19 can safely be at home with the symptoms. However, for a particular segment of our patient population, particularly the elderly and those with medical conditions before, this could actually result in a very serious hospitalization, critical care, needing intubation, being on a ventilator, and in some cases, death. So because of this, I think this is a tremendous responsibility on our citizens. As a new transplant here to Murfreesboro, I know this is the volunteer state and everybody wants to chip in, but the thing to do really, and sounds a little bit strange, is to stay at home, and is certainly appreciate the leadership from the city in terms of closing down the dining options and the gyms and those things, because that's the best thing that we could possibly to do to quote, flatten the curve.
Right.
So
if you were, as you're seeing the testing come along, can you explain the testing process and how y'all are seeing that come through at the hospital?
Sure. So testing has been a challenge and an evolving story over the past couple of weeks. We've been working in coordination with the State Department of Health and their testing capability. However, what we found was that quickly the state's ability and capacity to run the number of tests throughout the state has been limited. And so quickly, Ascension St Thomas was able to secure a contract with a commercial vendor. However, even that test does the turnaround time, we're estimating around 3 to 5 days. And so because of that limited capacity, we're really trying to be good stewards of who we send the test on. And so this is not the kind of thing that just because maybe you have a tickle at the back of your throat that you should come to the ER requesting a test. There is still sort of a triaging and careful screening process to make sure that the people that we are sending the tests do fit the criteria in terms of exposure risk, severity of symptoms, and that kind of thing. So what I would encourage our citizens to do is stay at home. If you do have symptoms, call your local healthcare provider and take direction from them. The ER really, at this point, should be reserved for a medical emergency, and so that is an extremely high fever or trouble breathing.
Okay. And that's one of the things that we were here on Saturday night, that there's a difference between assessment and testing. And just like if you were to go to the doctor, you'll be assessed, and then the doctor will determine whether you need to be tested. There's several questions that are coming in asking about, how many kits that we have in Murfreesboro. I know that there are continually kits that are coming in on really a daily basis after talking to a lot of our healthcare providers that are in town. So, the one thing I really want to stress is if you feel like that you're symptomatic, you need to call your physician and get assessed. You can call the county health department as well for assessment. Really learning through this process about how important telehealth is, that a lot of the doctors are now going through being able to handle telehealth so you don't have to come in, that you can get those things situated. Is there anything else as a community you guys feel like that we need to know?
I think one of the things that we are discussing with Dana Garrett at the health department is the need possibly for us to set up some additional call-in lines, where I honestly think that our residents are just so hungry to learn more about the symptoms and some of the ramifications. And so we are looking at ways that we can put a panel of healthcare providers together that could be available to answer questions. Currently, St. Thomas does provide some virtual physician visits, and if you go to our website, you can find that contact information. But I do think there's just a lot of benefit to that sharing of information to ease individuals' anxiety about what we're going through.
A couple of questions that have come across that are not necessarily medical, but want to reiterate, and I think I'm going to try to get this set up over the next couple of days. I want to have someone come in and be able to discuss where we are on supply chain in our community as far as groceries. If you don't need something, don't buy it. There's not anything that has come to us that has said that we have a run on the grocery store right now. So, if you're buying too much stuff, then that means that someone else cannot get what they need. So there's not been anything. There's been several questions asked about groceries. There's not anything that we have seen that says that there's a run on milk or bread or toilet paper. Please only buy what you need. You're hurting your next door neighbor when you buy too much. There's been a question on homelessness. Sam Huddleston, who's our development director, we've been in contact with Scott Foster with Journey Home today with the order that we put in place to make sure that there's some protocol going in with our homeless population. There's some protocol that they're putting in place through our community block development grant to be able to help. So I want you to know that that has been discussed, and that's something that we're working on to make sure, if someone tests positive that's homeless, how that works and what's going to happen from there. We've been in conversations, and I really want to thank the local churches. I've had conversations today with several different churches, and one of the things that we've been really concerned about, that how long that this pandemic goes, our emergency service providers and our healthcare providers are going to need help with healthcare. so had, or not healthcare, I should say, but daycare. And we had some talks with some of the local churches today that they are willing to be able to open up their daycare facilities or their child care facilities to be able to help those individuals. So I want y'all to know that we are working on that. I hope it doesn't come to that, but we're putting those plans in place. Dr. Gilbert, along with our Parks and Recreation Department, has also been working on that. I can't stress enough that, look, I got off social media for a while because every time I get on social media, you focus on the negative. And what I want to be able to reiterate to our citizens, it does no good to be able to get on social media and spread what you may have heard from somewhere else or that you may have Googled on an unsubstantiated website. We are going to do everything we can to be able to keep you updated. I made you that promise. I know the city council is on board. Our city staff is on board. So please, let's do everything that we can to be able to get information that's credible, information that we want to be able to get out to our community. The city hall, there's things that when I say city, the city business, we're going to do everything we can to be able to get essential services to make sure that if people need to come in and pull building permits, or if they have property inspections or issues. I had a lady who called me yesterday about a next door neighbor having an issue. So we're going to keep those things up and running, but you are going to see changes. I feel confident in the next several days at City Hall. We will keep you updated and let you know straightforward what's going on. Want to make sure that you still know that you can go to our city website. We have one section that's completely set up, murfreesborotn.gov/1690 coronavirus information. It's on the lead web page that's being updated consistently with CDC information, with Tennessee Department of Health information, with any information that we have that we can get out. We're going to do our best to get that out. So I'm going to do my best to answer some questions while I've got these gentlemen who are here. How many cases are confirmed in Murfreesboro? We see county numbers. We don't, because of patient privacy laws, we don't know where those cases are. We just know the county that they're in. So right now we have 9 in Murfreesboro. We said this again on Saturday. When you're tested, you could go to Williamson County and be tested, but if you are from Murfreesboro, just because you got tested in Williamson County or vice versa, if somebody from Williamson County gets tested in Rutherford County, that number goes on the county where you reside, not where you're tested. So I think it's important that everyone knows where you're tested. If you do come back positive, that is the county that you live in. We don't know the location. The health department knows that location, and they work through the chain that I talked about earlier. Schools, we don't know yet. We're continually working with Dr. Gilbert. I know Dr. Gilbert's working with the county school systems, county school system. We don't know yet on how long school is going to be closed. They are putting all the procedures in place to work through some distance learning. I know that there are several other schools that are in Murfreesboro who are working through that as well. Ultimately, I think we want to get our children back in the school as quick as we can, but at the same time, we want to make sure that everyone's safe. So I think you can rest assured that the city school system and the county school system is going to defer to the medical professionals, and they're going to do everything they can to make sure and keep our kids safe. Let's see. I'm looking through to see if there's some medical questions. Again, there's questions asking about essential and non-essential businesses. You can get on many different websites, really the state website, to see on essential and non-essential businesses. There's a lot of questions on a stay-at-home directive from the city. We're not sure that we have the legal authority to be able to do that. Again, that goes to, if you go back and watch earlier about how we're set up. But what I would tell you, and I think Dr. Yang hit on this as well, personal responsibility. If you don't have to get out, don't get out. You know, when I left, my kids were in my backyard playing together. Stay at home. If you don't have to work in the city of Murfreesboro, stay at home. Follow the CDC guidelines that are in place. Be smart. Be responsible. Don't be selfish to your neighbors on surrounding yourself around a bunch of people. That's why we work to be able to put the directive that we put in on Saturday. Just be smart and be responsible to our community. The quicker that we get where we can flatten the curve, the quicker we can all get back to our normal lives. And I was on 104.5 The Zone this afternoon, and you know, I feel confident. The more that I'm around our medical professionals, the more I'm around our emergency service providers, I'm more at peace to know the individuals that we have who are overseeing this. So this is not an area where we need to be fearful. It's where we need to be smart. And the information is out there. The information, we are putting it out there. So we all want to be smart in how we handle things. There are things that we can limit. There are things that we can do as a community to stop the spread, and we need to make sure that we're doing that. How many tests do we have awaiting results? Is that information that is out there? I don't think we know that information, do we?
Not across the board, Shane. And I do think that a lot of emphasis is being placed right now on trying to improve the testing turnaround time. I know within St. Thomas right now, there's a lot of people that are just focused on getting some equipment up and going so that we can reduce that turnaround on time on testing. And I would like just to pick up on what you said about the need for accurate information. We have got a number of rumors that we have come across that I have no idea where they came from, but are just not true. And really, we can't be distracted by that. We've got to be focusing on taking care of those that are providing care to our patients and making sure that they've got what they need to do their jobs.
Yeah, there's absolutely. I on Saturday night, I hit the comment that, you know, someone had asked me if I was aware that the 5th floor in the hospital had an armed guard and it was full of COVID patients, that we were hiding that. And I'm just like, that's not true. So, you know, again, go into social media, get your information from credible sources. There's lots of information where you can get in touch with us to get information. All right, I'm going to do a couple more comments. Daycares, there's a question of why are daycares open? Daycares are considered essential businesses. I hope you did listen earlier that we're working to make sure if it does get to a point that those have to be shut down, we have to be able to have something in place for our emergency service providers and our healthcare professionals to be able to have the ability to have someone watch their children. They don't get the opportunity to not go into work, and that's something that's extremely important that we need to make sure and look for. Last thing I want to say, again, we're going to do everything we possibly can to get the information out to you. I'm going to still be committed. Want to thank our city TV, and they're here at 7 o'clock on a Monday night producing this and getting this out. The reason that we're doing this on this forum, the one that we did on Saturday night, was done on my mayor Facebook page, but by doing this through the city of Murfreesboro, we're now, not only can we get out on social media, but this is going out on WGNS, our local radio station. This is going out on City TV 3. So there's a lot of people who don't necessarily look at social media that we can get this information pushed out. So want to reiterate, let's do our part as citizens of Rutherford County, citizens of Murfreesboro. We're going to all continue to work together. I've got faith in our healthcare providers. I have faith in our emergency service providers, and I really have faith in our community. There are things that we don't have control over, but there are things that we do have control over. And as mayor, I want to urge you, the things that you can take control over, please do that. And if there's any possible way that we can help you inside the city, we want to be able to do that. You can contact any of us. Your council members, we're easy to get in touch with. Gordon, Dr. Young, I want to thank y'all for being here. I'm proud for the healthcare community that we have here and what y'all are going to do. No one knows what's going to happen in the days to come, but we do know that if we work together, that we can continue to provide a good city, a good county for our residents. So thank y'all for watching. We'll keep you updated in the days to come.